Good morning, everyone, and welcome to day two of the conference, which has been outstanding thus far. My name is Judge Rankin. I'm a retired judge out of Minnesota. It's my pleasure and honor to introduce Sean Fearns. Sean has served as the Chief of Community Outreach and Prevention Support for the DEA since 2015, a position that includes management of the Dea Museum as well as the DEA Community Outreach and Prevention Support Section. In this capacity, Sean is responsible for guiding a diverse and creative staff to develop and implement strategic national partnerships with other organizations which help educate the public on the current drug threats facing the country, support the DEA field divisions, communicate key administrative drug prevention messages, and reduce the demand for those drugs, including implementing DEA's Operation Engage. Mr. Fearns is joining us today to talk about emerging drug threats in the United States. So without further ado, please welcome Mr. Sean Fearns.
Judge, good morning, and thank you very much for that kind introduction. I'm delighted to be here. I want to start by thanking you for all of your service, not just to the Addiction Policy Forum, but I know you've also been a leader with the National Association of Drug Courts, and I salute you for that. I want to certainly thank Jessica Halsey for the introduction, for the invitation to be here to speak with you all today. I do wish we were in person as we were in previous years, but hopefully with everyone following good public health guidance, we will be together again in 2022. The work of the Addiction Policy Forum is tremendous. And on behalf of all of us at DEA, we salute you and thank you for your hard work, dedication, and leadership as we all work together to try and attack and work against these drug issues that are facing this country. So I've been asked to speak about emerging drug threats. I'll take just a couple of minutes at the very end before we open it up for questions to speak about a couple of resources that DEA has available to you that we hope you'll take advantage of. If we could go ahead to the next slide, please. Before I get into it, however, let me first bring greetings on behalf of the DEA administrator. Some of you may know her, our new DEA administrator who was nominated by President Biden and confirmed by the United States Senate back at the end of June. Ms. Ann Milgram is with us now, and we're delighted to have her. Along with Ms. Milgram, I bring greetings from the nearly 10,000 women and men from across DEA in our 226 domestic field offices, but also as a reminder, we are in 70 countries around the world as we're working to go against these major drug threats that are facing the country and the trafficking and money laundering organizations that are affecting public safety and public health. Go ahead, next slide. So when we talk about what are the emerging drug threats as DEA sees them, I'm going to refer heavily to DEA's National Drug Threat Assessment. Some of you may already be aware of this piece, this product that DEA puts together. Go ahead to the next slide. I'm going to mention right now that it is available in its entirety on the DEA.gov website. A little light reading for you, but obviously it's important reading because we think it's a helpful tool for national, state, and local leaders as they work to engage their prevention, treatment, recovery systems, and criminal justice systems to address these issues. So what is the National Drug Threat Assessment? It is DEA's annual look at the major drug threats that are affecting the United States. It is an amalgamation of intelligence and data, not just from DEA and our field divisions around the United States, but literally hundreds of state and local law enforcement partners, police and sheriff's departments and the like, that help to pull together a look at what things are looking like on the streets in the United States, not just at the national level, but down at the regional level as well, because there are, as you all know, different parts of the country are facing different drug threats at any one time. We're going to talk about the highlights from this National Drug Threat Assessment. It was released in January, and it will come with a new edition after the holidays, and I'll certainly be able to provide you all with updates in 2022 as well. At the high level, we'll go ahead on to the next slide. Well, let's talk about the various transnational criminal organizations, drug cartels, if you will. They really fall into four categories in terms of major threats. Number one are transnational criminal organizations based in Mexico. They literally dominate the wholesale importation and distribution of all major drugs of concern in the United States. Second under them are the Colombian-based transnational criminal organizations. They are largely still involved in controlling the production and supply of cocaine, and they maintain their partnerships that were established back in the 1980s and 90s with Mexican transnational organizations. So the Colombians are the supply, the Mexican groups are the shipping and distribution hubs. There's also Dominican transnational criminal groups. They are fairly mid-level and they are fairly self-sustaining and self-sufficient organizations, not again as big players like the Mexican-based and Colombian-based groups, but they are there and we are aware and targeting them. And then the fourth piece I want to highlight is the domestic gangs. As some of you may already know, but please know that domestic gangs are an important local distribution network for drugs in the United States. They are opportunistic. They will follow wherever the money leads them. And that includes with different drug trafficking organizations. And of course, there is a direct connection between gangs and violence that continues to attack major cities. And that's a major cause for concern for DEA and for the Department of Justice. And so going after gang violence to help make communities healthier and safer is one of our high priorities. Let's go ahead and start diving deeper into specific items. And I'm going to take these relatively in priority order. And priority number one, as DEA sees it, of six, we're going to talk about six major emerging drug threats as we see them. The first one is this rising issue of opioid overdose deaths. Not new, but certainly COVID has made it worse. I am certainly likely repeating what you all heard yesterday, and that we're over 96,000 now through the CDC provisional data of March of 2021. That's a 30% increase over the previous year, and 3/4 of those overdose deaths are connected to opioids. The largest chunk of the opioid deaths are related to synthetic opioids, and it is a startling number. Just a few years ago, it was in the neighborhood of 190 to 195 Americans lost every day to overdose. Sadly, we are at 265 based on the data. Let's go ahead and go to the next slide. Talking a little bit more in depth about illicit opioids and heroin first. The fentanyl market here in the United States is supplied largely by cartels based in Mexico. They are getting their precursor chemicals to manufacture fentanyl largely from China. To be clear, we are talking about illicitly produced fentanyl, not pharmaceutical fentanyl that is used as a pain management product. Things like the fentanyl lollipop and the fentanyl patch, those are legitimately produced and controlled by the pharmaceutical industry. The problem is not that. The problem is the illicit fentanyl. It is the primary driver behind drug overdose deaths. The heroin market and the fentanyl markets are largely intertwined. The fentanyl market did not really exist many years ago, but it has grown, and drug trafficking organizations that have a menu of drugs that they ship simply added fentanyl into it. Oftentimes, our DEA forensic laboratories are finding that even heroin that is purported to simply be heroin has been adulterated with fentanyl. The seizures of illicit opioids and heroin at the southwest border are increasing. And our biggest concern right now is a rise in counterfeit pills, pills that are manufactured by drug trafficking organizations to mimic American pharmaceutical products like Xanax or Adderall or things like that. These counterfeit pills are widely available. Let me take a little deeper dive into that if we could have the next slide. We're talking about counterfeit pills. So the traffickers are making these specifically to exploit the opioid crisis, which started, as we all know, a decade or more ago, based on the misuse of prescription opioids. And even if individuals who think they are taking a legitimate prescription pill don't know it, there's no way to tell how much fentanyl might be contained in these pills. And it's largely based on the manufacturing process. Legitimate pharmaceutical products, most of which are, if they are a controlled substance, they are regulated by DEA under the Controlled Substances Act. Those are manufactured in a legitimate controlled environment in laboratories with proper protocols. The fentanyl counterfeit pills that we're talking about are manufactured in laboratories, labs in the middle of nowhere, Mexico and some other countries, with absolutely no controls. And as such, a batch of, say, 500 of these pills, half of them may contain no fentanyl. A third of them may contain some fentanyl, and the remaining portion actually could contain more than what's considered a lethal dose of fentanyl. And when we talk about, what is a lethal dose of fentanyl, we're talking about 2 milligrams. And just, to do a little show and tell, I'm going to use a little sweetener packet, and I'm not in any way maligning sweetener companies, but this is 1 gram or 1,000 milligrams of powder that's contained in a sweetener packet that you would get at a diner. And a deadly dose, a potentially deadly dose of fentanyl is 2 milligrams. So when you're talking about, that means that this amount of fentanyl has the potential to kill 500 Americans. Let that sink in terms of the scale. And when DEA is seizing kilogram quantities, bricks of fentanyl and drugs laced with fentanyl, the scale of the problem quickly becomes apparent. And the other challenge, frankly, is that the fabrication process on the outside is pretty realistic. Let's go to the next slide if we could. And here's an example on the left, your left, an authentic, normally produced, professionally produced Xanax from the pharmaceutical industry. Over on the right-hand side is a counterfeit Xanax that, again, to the average layperson, they don't understand the numbers or even the coloring systems that are on these pills. That looks like that could have been produced in a legitimate pharmaceutical plant. Go to the next slide, if you could, please. Now, disregarding the color, here's Adderall, and the authentic Adderall on the left. And in this case, the counterfeit actually does have a color match. And they've actually gotten pretty good at the dyes that they're using in these pill presses, which is another wave of attack by DEA, is the illicit use of pill presses that are to be registered with DEA if they're here in the United States. But again, it's very, very difficult to tell the difference between an authentic and a counterfeit. Even our forensic chemists at our laboratories visually have a challenge looking at this. The image on the bottom, I'm going to give you a pause here and say this is a 30 milligram oxycodone. Can you tell which one is authentic and which one is counterfeit? I imagine that you would struggle with it, as many Americans might struggle with it if they're thinking that they're buying on social media or online oxycodone. The answer is that the pill on the right-hand side is the counterfeit. The pill on the left is the legitimate, authentic oxycodone pill. Let's go ahead and go to the next slide. Here's just another example, and this is a different color scheme, but again, the authentic on the top and the counterfeit. Frankly, the counterfeit below looks even cleaner and more professionally produced in this case than the authentic pill on the top. In terms of what we are seeing when we are doing analysis, and DEA has seized major quantities of counterfeit pills. When we send our samples to our network of DEA forensic laboratories around the United States, in this past year, 4 out of 10 of these counterfeit pills have come back with a lethal dose of fentanyl. So 2 out of every 5 pills that DEA has sent for sampling, 2 out of 5 contain a lethal potentially lethal dose, 2 milligrams or more of fentanyl. So let's go on to the next slide. Again, we're just talking about illicit opioids. Okay, we haven't even gone to the other threats yet. This is very important. So what has DEA done in response to that? We began in August launching a nationwide law enforcement effort. Some of you may have seen the results of this at the end of September at the Department of Justice, where Administrator Milgram and the Deputy Attorney General announced that we had seized. This is just in one 2-month operation, 1.8 million fake pills with 810 arrests, not of users, not of individual drug users, but traffickers. And that the amount of pills seized just in that 2-month period had the potential to kill 700,000 Americans. So again, I go back to, right, 1 gram of powder, and we seized 712 kilograms in that 2-month operation. In addition to fentanyl, let me take a quick sidebar and say that it's not only fentanyl laced into counterfeit pills that we are concerned about. It is our biggest concern, but we are also detecting an increase in counterfeit pills laced with methamphetamine. And for anybody who thought that the days of methamphetamine were in the rearview mirror, that they were as much a rerun as Breaking Bad is now, methamphetamine has not gone away and is still an issue. There was over 4,000 kilograms of methamphetamine, and also an increasing number of kilograms of cocaine, 653 kilograms of cocaine. So stimulants, which I'll get to a little later, stimulants will also be an issue we're going to talk about. So that was one piece. The other piece that we've launched in the last couple of months is this awareness effort called One Pill Can Kill. And if you have already heard about it, wonderful. If you have already received a copy of DEA's public safety alert, it's the first time that we have issued a public safety alert since 2015. So we do not throw these out, you know, like a Macy's Thanksgiving Day sale. These are done when there is a major threat that we see to the American public. And so One Pill Can Kill literally is an awareness effort to say, if you are not taking a pill that was prescribed by a medical professional and filled by a licensed pharmacist, you should not be taking it. Because if you were to take something that you bought off the internet or got from a friend or a family member, there is a chance that it is a counterfeit pill. So we're trying to educate the public. Administrator Milgram's kicked this off with an appearance on the Today Show. We had done the enforcement operations at the end of September. Just this past Sunday, if you are a reader of USA Today, we had an op-ed in the USA Today on Sunday talking about this clear and present danger from counterfeit pills. We highlight the story of Ed and Mary Tiernan of California, who lost their son Charlie, one of many, many parents who have lost a loved one due to a counterfeit pill, and the rallying cry that we must raise awareness. We're trying to connect folks. Let me highlight the web address that's down at the bottom of this slide, dea.gov/onepill. If you have not gone to that site to grab a copy of our public safety alert, to grab a copy of any of the fact sheets that we have, or any of the graphics or social media content, please feel free to take that material and spread the word. We absolutely must raise awareness about counterfeit pills, and I'll be happy to, when we get to the end, to take some questions. So that is the first issue. Let's go on to our second bucket of re-emerging. I'm going to call this one a re-emerging threat, because many of us recall the days when methamphetamine was here. And I just talked about it. There are counterfeit pills laced with methamphetamine as well. Methamphetamine seizures are going up. And again, we are not in the days of the Breaking Bad labs in the recreational vehicle in the desert of New Mexico. These are super labs based in Mexico and other countries that are the primary producers. Domestic labs have been decreasing year upon year ever since the laws changed to make accessing precursor chemicals harder to do. If you ever wonder why it's difficult to get pseudoephedrine without signing your life away, just short of needing a prescription. That was as a direct response to the threat that methamphetamine was facing this country, 10 years ago. So those controls remain in place. So again, it is an international threat that is facing the United States. Let's go to the next slide. And just a graph to illustrate the scale of the increase. Again, it is not as big a threat as fentanyl and counterfeit opioids, but we consider it a secondary, as the second most significant threat, and the numbers are climbing. Okay, go to our third bucket. Next slide, please. And that would be the threat of cocaine. And again, I mentioned it before, the issue with cocaine is returning. Stimulants in general are returning. And, some very, very brilliant scientists and historians will tell you that when you look back in history, a depressant epidemic is often followed by a stimulant epidemic. So DEA has been waving the red flag about the resurgence of stimulants for some time now. Cocaine-related overdose deaths are climbing in some population bases. Again, not as significant a portion of the numbers. And you can go back to that earlier, not right now, but at some point you can go back to that earlier slide that lists them in order. And cocaine is a little lower down on the list. But seizures are increasing, and cocaine production has returned to record high. Let me go ahead and show you this next slide, which is fairly telling. This is I'm going to explain what you're looking at. This is a graphic that shows Coca cultivation and Colombian cocaine production over the last 10 years. So on the far left side of your screen is 2010, and on the far right-hand side of your screen is 2020. And the green bars that are going up vertically show cultivation and production of coca in Colombia. And so you could see that production, those green bars have gone up. The black line is eradication efforts against coca in Colombia. And you notice that there was a dramatic dip from 2010 down to 2016. Eradication efforts were curtailed by the Colombian government as a matter of policy. The eradication efforts have since returned and are climbing again through 2020. So, again, one of the issues that DEA and the State Department and others are working at internationally on making sure that we address the supply of drugs. Go ahead on to the next slide. Our next bucket is marijuana. It is by far the most commonly used illicit drug in the United States. It is readily available. It is still a Control I substance under the Controlled Substances Act. It is often grown on public lands to the detriment of the environment and the water supply. We all know that the legal landscape on marijuana is constantly evolving. Mexico remains the primary source of marijuana that's brought in from foreign sources. Obviously, there's domestic sources of marijuana. And of interesting note is that there have been intelligence that Cuban drug traffickers have established a presence in Colorado in order to try and take advantage of the legal markets at the state level for illegitimate gain. So we continue to keep an eye on that issue as well. The sixth and final bucket that I want to talk about are the controlled prescription drugs, where the opioid crisis that we're in now began. And controlled prescription drugs are available through illicit markets throughout the United States. Abuse levels and related deaths have gone up from 2020 to 2021. That's largely attributed to COVID. Let me pause and make a couple of comments about COVID impact on drug trafficking. We actually saw, as COVID first hit in early 2020, that it did affect drug trafficking organizations. They found it harder to move their products. The restrictions on border and travel had an impact. What they ultimately ended up doing was move larger quantities of product more infrequently. That they knew that they were only going to be able to get through the border so few times, and so let's ship more product over and then warehouse it until we can get it out into the distribution networks within the United States. We do see that, we do believe that as COVID restrictions lift, that trafficking has the potential to return back to pre-COVID levels, not affected by the impact of travel restrictions. So a quick sidebar on that. So the controlled prescription drugs are the second most abused illicit substance after marijuana in the United States. We all saw a really great flattening of the numbers in 2019 into 2020 and felt that, perhaps there was, some great progress coming. And then of course, COVID hits. And through a number of factors, that we all know affect substance misuse in the United States, the numbers have gone back up. The most commonly misused pain relievers are in the hydrocodone category of drugs. And then, of course, we know from our friends at SAMHSA under HHS, the majority of pain relievers that are abused or misused are obtained from friends and family without a prescription from a doctor. So go ahead to the next slide. One of the things that DEA has done, and I believe many of you that are joining from across the country this morning are in fact well aware and very involved in supporting national prescription take-back days. We do two of them, one in October and one in April. And while that is not the magic bullet cure-all for the controlled prescription drug issue in the United States, certainly we know that it helps to eliminate unneeded or expired or unwanted medications from the potential to be diverted into illicit markets and to be misused. Let's go to the next slide if we can. And let me talk to you a little bit about the results of the last Take Back Day, which was just a week and a half ago on Saturday, October 23rd, in 4 hours. Okay, so from 10 a.m. to 2 p.m. in 4 hours, we collected almost 750,000 pounds of unneeded, expired, or unused medications. We didn't do it alone, by all means. DEA is a very small organization when you look at the footprint across the United States. We did it with the tremendous assistance of law enforcement partners across the country. Over 4,000 of them helped us with this most recent Take Back Day, which is now in its 10th year. And there were just shy of 5,000 locations that served as take-back locations around the country, just on that Saturday, October 23rd. What we do hope truly, is that take-back, or the turning in of unused, unneeded, or expired medications, becomes as commonplace in America as putting on a seatbelt when you get into a car. Truly every day should be Take Back Day. And we applaud the businesses and nonprofit organizations and government agencies that have set up year-round take-back boxes in thousands of locations around the country. If you were to Google take-back location from your Google, from your phone right now, it will show you locations at local pharmacies and local police departments that are available not just in October and April, but all year round. And that is obviously an important piece of addressing the upstream end, because we know that so often misuse of prescription opioids can then lead to heroin and now this potential for the very deadly fentanyl. So we encourage you, please, to continue. This is my first call to action, if you will, from this session. If you could please assist with promoting the proper disposal of prescription medications, not flushing them down the toilet, but to dispose of them properly or turn them in to a take-back location. That would be fantastic. Let me take a couple of minutes. We'll go to the next slide and talk about some resources. Go ahead to the next slide, please. Since 1985, DEA has been involved in trying to support the work of the prevention of substance misuse and use, particularly with youth. And not over my shoulder, you might see the red ribbon banner. And for those that don't know the story, allow me just 30 seconds to talk about DEA Special Agent Enrique Camarena, who was serving in our office in Guadalajara, Mexico, left the US consulate on February 7th, 1985, to go to have lunch with his wife. He never made it. He was kidnapped by Mexican-based drug traffickers, aided, we believe, by Mexican federal officials, and was kidnapped, tortured, and murdered. And a lot changed in America. That woke up a lot of officials and a lot of Americans to the problem. Well, some kids in Kiki Camarena's high school in Calexico, California, started these clubs wearing red ribbons. And what DEA did was we stood up what has become our community outreach effort. Our effort is to educate and increase the public's awareness about the dangers associated with drugs, to support prevention initiatives across the country, and to work with national and local organizations like Addiction Policy Forum, as well as governments to try and reduce the demand. Let me highlight a couple of things for you. Go ahead to the next slide, please. We are delighted to have a number of national partnerships to include Addiction Policy Forum, and our partnerships grow at the national level. Plus, we have 23 DEA domestic field divisions around the United States. And each one of those DEA field divisions have partners. You know, for those of you from the law enforcement world, you know that our willingness and our ability to partner in task forces and in enforcement actions, it's in our DNA at DEA. We would not be successful if we did not partner with other law enforcement organizations, not just here in the United States, but around the world, to have an effect on the supply of drugs and the drug trafficking organizations profiting off of it. So we bring that same attitude and approach to our work in support of prevention. Go ahead to the next slide, please. A quick word about Operation Engage. 11 of our DEA field divisions are conducting Operation Engage, and you can learn more about it at operationengage.com. We are connecting the DEA offices more with their communities, leveraging our local DEA intelligence. So Operation Engage says, and I'm going to use this as an example. Here in DEA Phoenix, our #1 drug threat that we see is the rise of methamphetamine. Therefore, we are going to try and work with state, local, federal, all of the different sectors of the community in a coalition with the local anti-drug coalitions, if you're familiar with CADCA, to work against that #1 threat, while we at DEA continue to focus on the trafficking and money laundering aspects of the methamphetamine threat against Phoenix. By raising awareness, we help to change attitudes. When you change attitudes, you change behavior. We're applying the best in evidence-based and science-based prevention science to address these threats. It's a realization that different DEA offices around the country are seeing different drug threats. Some offices, it is the fentanyl issue. Other offices, it's controlled prescription drugs. Other offices, it's the return of stimulants like cocaine or methamphetamine. Okay. I'll go ahead to the next slide. This is my second call to action. Please, and forgive the phrase, use and abuse these resources. So we have a number of websites that are available to you all and to the public. Campusdrugprevention.gov is for colleges and universities, practitioners who are working to support drug prevention at the college and university level. GetSmartAboutDrugs.com is for parents and caregivers. JustThinkTwice.com is for youth, teens, young adults. And then operationprevention.com is for teachers. And that in particular is a partnership we have with Discovery Channel folks, Discovery Education, for science-based activities. And God bless, we were able to get it done before COVID. And so it's all digital, it's all free. There's no login or membership or cost required. And then the other side of the slide there is just a highlight of some of the publications that we have available. The newest one right there in the center, Growing Up Drug-Free, A Parent's Guide to Prevention. That's actually the DEA and the US Department of Education partnering together on that piece. We do, even in 2021, ship out hard copy quantities of these. But quite frankly, we know that digital is really the place to be. And so everything's available for download at that web address that's down at the bottom, getsmartaboutdrugs.com/publications. The other resource, the third call to action and final call to action I have for you, is our human resources at DEA. We have a network of offices around the United States. What I am talking to you about today in terms of emerging drug threats is at the national level. There are nuances to those drug threats when you get down at the local level. And I want to encourage each of you, if you don't already engage with and connect with your local DEA field offices, to please do so. And you can do so by starting at dea.gov, and you can go and click on the individual field division that's closest to you, and you'll have a phone number and an email address. And again, many of you probably already are, and that's wonderful, because again, we know that when we have an effect on a drug issue in the community, that there are sectors of the community that must be at the table. And law enforcement is one of those sectors, along with education and prevention and treatment and recovery, and civic and corporate and faith-based, and elected officials. So please take full advantage of this network of DEA offices around the United States that you can access at dea.gov. And then my final comment is for those that plan to or are in the Washington, D.C. area. Yesterday, the Dea Museum reopened to the public after a 2-year renovation. It wasn't going to take 2 years, but COVID caused a bit of a delay there at the end. But we have reopened the museum. It is a resource for learning about the history, this 150-year history of the drug issue in America, the science behind it, the science behind prevention, and also how each individual, and we hope we're going to get as many kids and adults as we got before we closed for the renovation, we want them all to be an agent of change. And I know that seems silly to play off the DEA special agent, but truly, when every American comes together to work together on this from all the different sectors and all the different elements of the continuum, from awareness, prevention, intervention, treatment, and recovery support, we know we can make a difference. And history, as displayed in the museum, tells us that. So finally, let me put up my contact information. Again, DEA is working hard every day to help make our communities safer and healthier. You will hear more from DEA Administrator Ann Milgram about that in the months ahead. Please share our One Pill Can Kill counterfeit pill awareness materials. And if I or my tiny staff at DEA headquarters can assist you, our phone number, our email address, and our website are listed there on the slide. Judge, with that, I will shut up and allow folks to ask questions. I do hope that you have found this information helpful, but know that it is a snapshot from a moment in time, and that as the drug issue evolves across the country, it is critically important that law enforcement, prevention, treatment, and recovery, and all the different sectors of the community stay in close coordination and avoid silos, as Jessica so often talks about, and the Addiction Policy Forum exists to help address. So thank you for your time this morning, and Judge, back to you.
Sean, I can't thank you enough for your very important and informative presentation and all the work that you are doing, the DEA is doing. I would encourage the participants to share with their communities the information that has been provided by Sean today. It's so critical. And I hope you all will do that. And I see we have a number of questions for you, Sean. And Sean Rogers, if you would present those to Mr. Fearns, please.
Sure, that was a great presentation, Sean. It's really eye-opening. Go ahead.
Just before we get to the very first question, I didn't say this out loud, but I'll say it now. The slides that I presented are not law enforcement sensitive or secret. So the Addiction Policy Forum is more than welcome to share them out to all of you who are participating in this summit. And please, again, take that information and use it as you work to make decisions at your level for how to address the drug threats we're facing. Thank you, Sean.
All right, we'll go ahead and jump into these questions. Are there United States operations to curb the use of the internet and the distribution from China and other host countries of counterfeit drugs?
Yes. Yep. So one of the things that we are really happy about is, and many folks don't really necessarily appreciate this, but if you recall, I mentioned earlier on in my presentation that DEA has offices in 70 countries around the world. And what's really important to know is that the drug issue is a thread that binds countries together that otherwise might not work well together on other issues. And you will find, for example, that the United States and Russia, the United States and China, the United States and India, the United States and Great Britain, the United States and South American countries, with the exception of a couple, have largely worked well together. And the issue of going after international trafficking, not just of the drugs, but of the precursor chemicals used to make the drugs, goes back all the way to the 1930s and 40s. If you all remember the Gene Hackman movie, The French Connection, that was the first time that the United States really got involved internationally in going after precursor chemicals. It was Turkish opium being brought through Marseille and Paris, and then into New York, where it would be trafficked by organized crime, mafia families. That holds true today, that DEA has offices in China, DEA has offices in other source countries, and works very closely through the State Department and through our US embassies with our foreign counterparts. In partnership, and even several years ago, China stepped up and began to regulate precursor chemicals used to manufacture these illicit fentanyl products. So that work continues. Work continues with investigations on the dark web. Work continues on investigations with the legitimate web and with money laundering through those means. And then obviously, DEA Administrator Ann Milgram, in this current counterfeit pill effort, has challenged social media companies to step up and do more because the source of counterfeit pills so often for individuals who are ordering them, even thinking that they are legitimate legitimate Adderall or legitimate Xanax or whatever the product, but asking social media companies to do more. So yeah, that effort continues on multiple fronts: money laundering, enforcement investigations, and control of the precursor chemicals used to manufacture the products. That alone is not enough. We also need to raise awareness with every American that if they're not taking a pill, that they should not take a pill that is not prescribed for them by a licensed medical professional and filled by a pharmacist.
Got it. Great. Next question. Why would dealers and traffickers lace their pills with lethal doses of fentanyl? Aren't they just killing their customer base?
Yeah.
Go ahead.
Yeah. That question comes up very often. Why are traffickers trying to kill their customers? And the answer is they are not trying to kill their customers. They are trying to hook them. They are trying to get them addicted to a product that will keep them coming back. What this boils down to is the black market fabrication process for these counterfeit pills. And I guess if you were to use the analogy that if you're sitting there in your kitchen and you were to throw some ingredients into a blender and you were to hit puree, sometimes those ingredients are going to get evenly distributed throughout the entire cake that you're baking. Other times, if you're not doing it right, and if you're not a trained pharmaceutical manufacturer, things are going to get bunched up and it's not going to be evenly distributed. And so you will literally get pills that are counterfeit, that are coming into the United States, that the drug trafficking organization thinks has just a little bit of fentanyl in it, because there's also, quite frankly, the science of addiction tells us that the brain is hijacked and the individual will seek out the product that their brain tells them makes them feel better, to the detriment of many other things in their lives. And their brain will say, go seek that product out, it's going to be great. And that because of the awful production process for those pills in Mexico and other countries, they are playing Russian roulette when it comes to just how much fentanyl is actually in that final pill. It might be just a grain, it might be 2.2 milligrams, and who the heck knows?
Right. Next question. I don't know if you can answer this one, Sean, or not, but what is the ratio of opioid overdoses from opioids that were prescribed to patients versus imported / bought on the street? Any ideas there?
We don't actually have access to that level of detail. We do know from tracking that there's a difference between opioid overdose death and synthetic opioid overdose death, excluding methadone, but we don't have that level of data. What we can tell is what we analyze through our forensic laboratories, and we have a network of forensic labs and forensic chemists employed in those labs who are analyzing the samples seized in our enforcement actions and using that intelligence to not only identify the chemicals that are involved, which can lead to the precursor chemicals, which lead to the sellers of the precursor chemicals, but also to the individual traffickers, because we have a signature program where certain drug trafficking organizations have signatures. They leave a chemical signature behind. And so we do know that. But in terms of the total ratio of legitimate pharmaceutical versus counterfeit, I do not have that information.
All right. This next question is interesting. Kimberly says that she believes anxiety drives stimulant use, and she says that they saw a sharp increase in meth over opioids right after COVID, right after the COVID shutdown in March of 2020.
Mm-hmm.
The majority of the clients we were seeing at that point in our detox and rehab inpatient program were reporting that they had chronic anxiety prior to COVID, and they couldn't handle the anxiety triggered by the threat of COVID and of everyday life changing. They were using meth as a means to remain hyper alert without the negative feeling of being anxious. They didn't want to lose that hyper alert state, as it was their safety mechanism. She wants to know, she's curious to know if there is a precedent of what to expect based on historical patterns, what to expect next.
Well, all I can tell you is what, again, DEA doesn't have, unfortunately, a magic crystal ball, but we do know that historically that stimulant crises have followed depressant crises in the past history of the drug issue here in the United States. And certainly, as Kimberly, you point out, there's a number of DEA field offices, a number of community leaders are seeing that exact thing happen as we speak. I would ask everyone to please pull out the materials that might be a little dusty sitting on the shelf from the last methamphetamine crises from the late 90s, early 2000s. Everybody perhaps remembers the Montana Meth Project, right? That we have lessons that we learned for what works with communicating to the public about the dangers of methamphetamine, and that, quite frankly, that needs to be brought back out again. Ultimately, drug control strategy will say that it's difficult to play whack-a-mole on the new drug du jour, that ultimately we want to pursue strategies that reduce the demand for drugs, of all drugs of misuse and abuse, and that we also want to reduce the supply of the product coming into the United States, so that regardless of what the next drug crisis is, I suspect it will be a synthetic product. The chemistry, the ease of chemistry, the ease of development of new slight tweaks to a molecular structure tells us, and of course the ease of manufacturing things like fentanyl that can be done in such a small quantity at such lethality or potential addictive quality, that will likely continue to be the issue going forward.
All right, thank you. Next question. We have a doctor that says that many patients ask if a regular pharmacy would be willing to take back unused or expired medications. I often don't know if pharmacies, as a rule, will take back medications. Is DEA looking into making take back days a regular process through pharmacy chains? It says it would seem like this is something long overdue to make take back a regular occurrence rather than only twice per year.
Thank you, doctor. Every day should be take back day. And we are delighted that Congress actually changed the law a couple of years ago. And now pharmacy chains are capable of being take back locations. The only limiting factor is that our friends in Congress changed the law, but didn't provide any funding. So there's been a little bit of a slow adoption by for-profit businesses to set up take-back locations, because obviously there's an expense to do so. But we see examples all over the country where, good corporate citizens, the Walgreens and the CVS and the Eckert and Walmarts and others have stepped up, and they have set up take back boxes in their pharmacies for the public to come and turn back in their medication. Not all of them have yet, which is why we suggest that other than that one day in October and one day in April, if you go to deatakeback.com, our website will point you to registered year-round collection sites. Or you can just Google, and that Google has been working with the National Governors Association and others to get data lists of where there are year-round take-back locations, because not everybody needs to register with DEA. If you are a pharmaceutical manufacturer, wholesaler, reseller, pharmacy, yes, you do need to register with DEA. But your local police department has the authority to have a take-back box in their lobby. They don't have to be set up and registered with DEA because they're law enforcement. And so, it takes a little bit of checking right now, but we have seen a shift in the last couple of years with more and more and more folks supporting take back locations that are open, maybe not 365, but darn near close to it. And we salute them for doing that. That has to happen more and more and more.
Right. Next question here. Megan says that her brother died of a fentanyl overdose in February 2020. One of the challenges I am facing is trying to clarify what fentanyl is to most everyday people I chat with. I knew about fentanyl, and yet on the day he died, I was still Googling fentanyl and trying to figure it out. Often the media will say they found fentanyl pills or somebody died of a fentanyl overdose, and not state that you don't buy fentanyl pills. You're purchasing manufactured prescription drugs that are laced with fentanyl.
Exactly.
I appreciate the DEA's clarification and hope the media can become more aware of a very confusing situation and use accurate terminology. Are there any plans to continue to educate the media?
Well, let me first say how much I am sad to learn of your loss. We meet too often at headquarters with families. Just on Wednesday with Ed and Mary Tiernan of California, and actually the work. Let me take a quick sidebar. The work to get the Combat Methamphetamine Act passed a number of years ago was largely based on the work of Francine Haight and other mothers who had lost their sons or daughters or loved ones to a methamphetamine issue. So never underestimate the power of a parent to make a difference. And I want to encourage anyone who's part of today's meeting who has lost a loved one to be active and be involved in any aspect of this, whether it's to help get people to treatment or to support folks that you know who are in lifelong recovery, or to spread the word of prevention. Yes, we absolutely have more plans to continue to push for the awareness that one pill can kill. Just on Sunday, USA Today op-ed piece across the United States. We will continue to push. We are going to be doing more media work. The news cycle moves so fast that even just a big splash a week ago and people are on to the next thing. Let me reiterate, we are not talking about going out and seeking fentanyl. We are not talking about prescription grade fentanyl that's prescribed for pain. We are talking about pills that people are looking to buy largely on digital e-commerce, social media platforms. They think they're getting a legitimate Xanax or a legitimate Oxycontin or a legitimate hydrocodone pill. They are playing Russian roulette because they might be buying something that's fake. And that's the message we have to get out. DEA.gov/1pill. Please, everybody, grab the material and share it as you want. DEA is not looking for the credit here. We're just trying to put out the public safety alert that this is a major issue. I mean, last year alone, we see, just us, 9.5 million pills that were counterfeit, just DEA, and we're one law enforcement organization. Bad. So again, thank you for asking the question. I'm so sorry about your loss. The fact that you're here at this important meeting tells me that you want to continue to be involved. Please continue to speak out and engage, and you can move mountains. I know it. Thank you.
Great. A couple of marijuana related questions. We have an attendee that asks, I would like to know how the DEA feels about drug decriminalization of marijuana.
This is not an attempt to sidestep the question. It's an important question. At the end of the day, DEA is an enforcement organization that enforces the Controlled Substances Act. Today, marijuana is a Schedule I product under the Controlled Substances Act. If tomorrow the Controlled Substances Act were changed and marijuana's position on the schedule were to change, then DEA would enforce the law. In the meantime, we will continue to talk about the placement of Schedule I marijuana, why it's there, the impact that it has on the United States, and the science behind it.
All right.
I can have a, Sean, thank you so much for joining us again this year. I just wanted to jump in with one quick comment. Some of the pieces that you've shared and updates, particularly around the dangers with counterfeit prescription pills, it's just so important. And as a partner, Addiction Policy Forum, we're going to make an extra commitment to make sure we get that out. And even using a segment from your presentation today, I think we might need to turn you into a PSA or a little video explainer, and then get it out to not just our network, but to share it with all of our attendees and all of our groups on the ground so they can share. I agree with some of the comments in the chat. This isn't being reported widely enough. People don't know the risk. I sort of keep seeing like updates from you all, from sort of our agencies and those that are really at the front line of this. And then there's so little discussion of it out in the communities. So we're going to double down our efforts to work to push this information out, and continue to check in with you to see what else we can be doing a better job amplifying.
And while I am not specifically aware of specific plans, Jessica, I do know that many of the social media companies are also looking to step up, given that a good chunk of the trafficking of these products is happening on social media. They know that they need to be good corporate citizens, and I think you're going to see them getting much more engaged in the months ahead too, which is important. But I can't, the one thing that hasn't come up in our conversations, and that's the value of trying to get peer-to-peer, youth-to-youth conversations going. And that's one of the things that we're looking to do, is to be where young adults are, to talk to them about the dangers of taking a pill that's not prescribed to them. And so let's all try and also think about how we can get young adults aware and talking to each other, rather than listening to the old farts talking down to them.
We have
go ahead, Jessica.
We have a new campaign we're launching. I think we're actually going to partner with Jill at the DEA Educational Foundation to push this out. I think this could be a new segment we add to that, and that is focused on adolescents as well as maybe young adults, with narration by a younger person. We could bring more folks in. So we're going to follow up with you. This is really important data that you've shared today, and a call to action, and we're going to respond quickly.
Jessica, let me know how we can help. Seriously.
I was just going to follow up, Sean, with what you're all saying, because as a sitting judge, when I was on the bench, we saw so many young people using opioids, given to them by either friends or, think it's Xanax or Adderall or whatever. And are you working with the Department of Education at all to get the word out through them?
Yes.
So the kids know that these counterfeit pills are out there? I mean, your presentation today was outstanding, and that particular part of the presentation really was incredible. And I think people really have to get that knowledge out.
Thank you, Judge. Yes, there are 4 or 5 federal agencies that we work with daily on the support for prevention and getting the word out. Obviously, the Drug Czar's office, the Office of National Drug Control Policy, the U.S. Department of Education, the Substance Abuse Mental Health Services Administration, and the National Institute on Drug Abuse. And I know Dr. Volkov, I believe she spoke to you all yesterday. They're our brain trust when it comes to, we know the intel of the drug problem on the street. How do we communicate it effectively to different groups in order to move them toward better awareness and changed attitude? Thank you, Judge.
Well, I think we're coming up toward 11 o'clock. I think that's our next presentation, Sean. Again, Sean, thank you so much for your presentation. It was just excellent. And it's so comforting to know that we have people like you that are advocates at the DEA and the work that you're all doing, as well as your administrator. So thank you very much.
Thank you, Your Honor. And thank you, Jessica. And I wish all of you a very good work as you continue each in your respective areas. We're at this together, and that's the most important thing. Have a great day.
Thank you.
Thank you, Sean.